Good afternoon and welcome to day 4 of the 2021 Stockholm Forum on Peace and Development. Our theme this year is promoting peace in the age of compound risk. I'm Vongai Murugani. I'm a researcher at SIPRI. And the title of our session is Community-Led Initiatives for Better Engagement and Response. So we're looking at this topic because the COVID pandemic has really changed people's lives, increasing the number of people in need. And from what we've noticed, government's response is unable to cope and unable to give support to everyone in need. In response to this, communities have risen up and taken charge of the situation and launched their own initiatives. And we are joined virtually by Eleanor, Whyle, Hannah Murphy, and Pamela Hartley-Pinto to talk about this. Eleanor is representing Cape Town Together. Hannah is representing Baltimore's My Oak Public Market. And Pamela is representing a food security working group from Lima. So let's get started. And we'll start with Eleanor with a question to you on why did you start Cape Town Together?
Thanks, Vongai, and thanks for inviting me here and the opportunity to speak to the forum today. This is really exciting. I think the first thing to say is that I myself didn't start Cape Town Together. Cape Town Together was started in some ways by a group of community organizers, activists, doctors, public health researchers, people kind of in the field of public health who anticipated what COVID-19 was going to mean here in Cape Town. Cape Town is a particularly divided city in which we have huge economic inequality. And as we saw the lockdown start to approach, as it wasn't, we had about 4 days preparation from when it was announced to when it was implemented in response to, the first couple of COVID-19 cases. There was an awareness that among this group that what was going to be needed was a network of organizing, a way of responding that could spread faster than the virus, and that we couldn't rely on the government to provide that. While there was definitely a good faith effort to respond, it was not going to be enough and it wasn't going to be fast enough. And so this group sort of came together and initiated what became a sort of sprawling network of community-led teams, which we call community action networks, CANs. And CANs exist in a sort of hyper-local way in neighborhoods across Cape Town. Anybody can start a CAN at any moment in their neighborhood, and a CAN can do whatever they think needs to be done. And a lot of the responses have been more responses to the socioeconomic insecurity that came with the lockdown and with the sort of economic challenges associated with COVID-19 than responding to the virus itself. And a lot of that has been around organizing around food and sort of community support for people who were out of work or couldn't work because of the lockdown. But then these CANs are joined together in this network that we call Cape Town Together, and through these kind of organizing nodes. And the nodes, again, anybody can start a node, and a node is basically just a way of organizing across CANs. And they pop up and disintegrate as and when they're needed, and when they're no longer useful, they go away. And I'm a member of a node that we call the Connecting CANs node. And what we try to do is just make sure that there's enough platforms for sharing information and experience and sort of inspiration across the CANs, and at times sharing resources too, although that hasn't been the main way in which the CANs have worked together. Most CANs are entirely self-funded and manage their own resources and don't need any support from outside. But so yeah, I think we anticipated that there would be a need for something local and something community-led, and then there was this amazing group and this amazing response to the call.
That's really interesting, and I just want to just take you back to the issue that you mentioned on inequality. How have these CANs affected relationships between communities and within communities in Cape Town?
I mean, people have, every CAN is different, and every CAN has a different story to tell. But in lots of ways, what we've heard people saying is that the relationships that they've built with people in other cans has been one of the sort of most valuable and enduring aspects of the movement and of this experience, because of these kind of, and it's, you know, Cape Town is, the geography of Cape Town is still structured by apartheid in lots of ways. There are communities that are actually geographically close together, but are separated by, you know, roads or rivers or big buildings or vacant land. And that was a deliberate strategy under apartheid to keep communities apart. And what Cape Town Together has managed to do is give people a platform to realize that their experiences and the challenges that they're facing are shared, and that working together, you know, you can do more working together than you can working apart. And it's broken down a lot of those geographical divides, but also some of those sort of social and class divides that I think still pervade Cape Town.
Thank you very much for that, Eleanor. Really interesting take on what you've done and achieved using the cans. Just a reminder to our participants that if you have questions, you can use the Q&A box to get in touch with us. We'll be addressing your questions a bit later on during the panel. Moving over to Pamela. So Pamela, I know you're coming from Lima, a really different context from Cape Town. You've also introduced or formed a food security group. What gap does your intervention fill?
Yeah, well, first of all, thank you so much, Vongai, for the invitation. It's really an honor and a privilege to be here speaking with at SIPRI, so thank you so much. And my answer kind of goes similarly to Eleanor's. It wasn't me. I didn't form the working group. 100% credit goes to the community leaders, and all those organizations that really support them along the way. This initiative kind of started out of the need of an emergency response. The government measures were completely insufficient, and early March, Peru had a nationwide lockdown, one of the most strict in the world, really. But in a context of informality where 70% of the population depend on the informal economy, these lockdown measures did not work at all. People tried to follow them, you know, stay home, stay put, social distance, wash your hands. But when we're talking about informal settlements, really, it's very hard to follow those measures, especially when you don't really have water to even, you know, have anything for food, for washing your hands, in a context of a sanitary emergency, COVID-19. It's very difficult. So these initiatives, these community-led initiatives started out of the need a couple days, a couple weeks right after the national lockdown was put in place. And it really formed as something that was based out of community networks that were already put in place, because all of these communities have been working together day in, day out in an emergency that's poverty. You know, they know how to organize, they know how to find resources where there are none. They know how to articulate and advocate for themselves. And all those skills, all that social capital and capabilities that they've been using all throughout their lives were really incredibly useful in this time of need. And they came together into what we now call community-led soup kitchens, or in Spanish, ollas comunes, which literally translates to communal pots. And you can find all of them in informal settlements. They're artisanal, they are 100% community-led. Some of them really use firewood and don't really have a formal setup, but they still work really well. And they're mostly led by women, which really highlights, you know, the amazing potential of all of these communities.
Thank you very much for that, Pamela. Really interesting work that you are doing in Lima. I just wanted to follow up on you talking about communities using existing networks, and also just looking at how that has worked to improve relationships, or has affected relationships between people in the communities. I know Lima has quite a significant migrant population. How does that work?
Yeah, so I think these community networks have really been stronger now, basically out of need. all of these community networks are based on tradition, on solidarity, on resilience, on really listening and having a really good idea of what is going on and what is needed at every moment. And again, I think that has to be highlighted all throughout, because nobody knows their community better than the community members themselves. So they know exactly how many kids there are, how many elders, how many pregnant women. They really do know their communities extremely well. So that needs to be taken into account. Now with a huge migrant population, mostly migrants and refugees from Venezuela, some of them have been incorporated into these community-led soup kitchens, but their dynamic is very different. As a population, Venezuelans are really not used to using soup kitchens, so they try to be a part of it, but there's a little bit of tensions there, but still there's really a welcoming climate, and at the end, everyone needs to eat. So there really is this sort of coming together and working together to get that food and that assistance that is needed.
Thank you very much. Really interesting what you're talking about different dynamics and the tensions that might come about as a result. I think this might be something that we might explore a little later. And finally, we turn to Hannah. And now I know, Hannah, the response that we're going to talk about was built off of Baltimore's city structure. Can you tell me how the city's existing infrastructure for emergency response helped you to respond, or helped communities respond during COVID?
Thank you. Very happy to be here with you all this morning. So Baltimore City is a really unique place in the food landscape, the municipal, their city food landscape of America. They have already integrated explicitly food response into their emergency management operations. And this is due to past events in their city that has necessitated that. So they have found themselves the folks responsible for food systems planning in the city have found a seat at the table, or they've really demanded it. They've really pushed for that. And this is going back as far as 2015. So they have been integrated into emergency responders, which there's a lot of different components of that, as I'm sure you all are familiar. But food particularly, Baltimore is a very, it's a really unique place, and the city has recognized that. Each community, each neighborhood is very different. Although geographically it's very close together, you cross one street and you can feel that you're in a different neighborhood. And these neighborhoods have an immense amount of pride, their own identity, their own sense of identity, their own sense of what their needs are, and what their own assets are. So the city of Baltimore has done a really good job of recognizing that and cataloging and allowing for these kind of diversity of assets, a diversity of needs, and integrating that into their emergency food response plan, whether it's recognizing urban farms, community gardens, other community-led initiatives, of course, accounting for state and federal programs, but they have really highlighted what the hyperlocal assets are. So that's something unique about Baltimore.
Thank you. So can you then just tell us how that existing infrastructure has helped in the COVID response that you've witnessed in the city? How has that helped improve relations, or how has that changed relations?
What we saw as kind of an outside perspective, as designers working in the food system, we saw that the city of Baltimore did a really good job of compiling all these. So they were really acting as a conduit. And that really changed relations because folks knew that they could go to the city for as comprehensive a list as they could manage. And they were also very, I think their approach was very people oriented in the sense that they allowed for a lot of input. And as these really hyper-local community-led responses popped up throughout the city that were in response to kind of like the gaps in a city-run response, it was very easily integrated. So they were agile in integrating all that information, making sure it was available as much as possible. And one other aspect of how it's changing relations is they now have two major disruptive events in their experience as a city. So their perspective has shifted a lot more holistically and long-term than I think a lot of other cities. So they are aware that this is not a one-time incident. And whether it's a civil disruption or a viral disruption, as they've experienced as a city, they know that this is something that can continue in many different forms, disruptions in general. So changing the landscape of how they approach it, in less being kind of a top-down planning response, and really embodying this idea of being a conduit. So pulling in federal, state resources, organizing data, organizing any kind of information that they can share, and disseminating that out to a network of community partners who then have their own networks. So they're really creating a web of relationships across the city.
Thank you. I like that you talk about them as a conduit and also as an institution that has decided to abandon the top-down approach, but actually work from the bottom up. I actually just want to stay on with you and ask then, the initiatives that happened in your city, like elsewhere, happened in a context of restrictions, or on gatherings at least, and a changed way of doing things. How did the actors in Baltimore deal with this? How did they work together with the city to make sure that they could still get the help where it was needed, but also adhere to the recommendations?
It was really interesting to see our research that led us to, just to give a slight background, that led us to see this kind of dynamic. We were focused on restaurants, and we were interested in how restaurants could divert food waste and prevent it from even being an issue. Of course, we saw like a really big tension in that issue once COVID hit in the hospitality industry, with businesses shuttered for operations as they knew it. But then the suppliers down that supply chain were left with all this surplus. And what we saw, what was really interesting about the community-led actors that we were observing, were they were able to very easily divert. They could make decisions very quickly on the resources that they needed, and they made a decision as a organization that they wanted to keep their operations going. So when we talk about you know, how that can be integrated into the city, is really allowing for these individual organizations to kind of do what they need to do to keep people being fed. And in terms of actually feeding people, a lot of the strategies from the city level were focused on kind of mass feeding, distribution, and this became a real challenge with social distancing. So the restaurant partners having kind of infrastructure set up to cook their meals, to bring in food, and having space to keep social distance, and then work directly with other organizations within the community to figure out how best to distribute that. So they're making direct connections, and I think that's the most important part, because that way it's easier to make those really safe decisions. So actors are able to do what they can, their little piece. So in the case of restaurants, still cooking meals, instead of connecting with individual diners, they're connecting with community organizers who know exactly where those meals need to go, and are able to make the best decisions for their communities to keep them safe.
Wow, thank you. Thank you for that, Hannah. I just want to move to Pamela then, who comes from a completely different situation. She spoke of artisanal responses, and we're moving from this restaurant coordinated response. Why were soup kitchens opening up when the formal response was shutting down? What made it possible for them to open up, and what about Lima's authorities and how you worked together with them made this possible?
So again, they emerged out of complete need. It was what it needed to happen, and it needed to happen quickly. This ad hoc response, it was a direct response to the crisis. And the reason that they worked and that they worked well was because they already relied on social networks and social capital that was already there way before COVID, way before the crisis. So they used those networks and those that social capital that's really ingrained in all communities, but especially in informal settlements where really communities have to work together to get things done. I think we also have to highlight the amazing work of the women that lead these community-led soup kitchens. They are mostly 95% led by women. These women know how to budget. They know how to make scarce resources last. They know how to advocate for themselves and their families. They also know how to articulate with a variety of actors, faith-based, municipal leaders, local organizations, NGOs, communities nearby. So they know how to get things done. And more than anything now, that leadership really started to shine. And that's also how this food security working group came into place. They started communicating with each other and said, in reality, we have a lot of the same problems from different districts. So they came together and they started articulating to have a better response, a more articulated response altogether. And that's how now there's a platform that meets weekly and is able to meet with local officials. At the very beginning, a lot of local authorities didn't really take them that seriously because they're used to having community leaders just tell them, oh, we need this, we need that. And it's part of what they're used to hearing. But with this this crisis and this emergency, it's also a food emergency, they really had to hear them, and really the community leaders would not take no for an answer. So they would show up with their community mapped. They have a census. Every community has their own census, so they know how many people live there, how many kids, what I mentioned before. And with that list, they said, this is what we need. And they demanded that. And that's how this whole movement of community-led soup kitchens and the food security working group started, with data, with incredible organization, and not being willing to take no for an answer.
Thank you for that. I like the women showing up with data and approaching city officials with demands that they're not necessarily used to, of we have a plan, this is how we want you to help us. I just want to move over to Eleanor now and just talk about their response with Cape Town Together. Now, I know you started it under lockdown, and you said that it quickly grew from when it started. Now, I know as it grew, it likely attracted a lot of attention from city leaders and from other community leaders. How did you use that attention to establish it and also to improve relations with Cape Town officials?
Thanks, Vongai. It's such an interesting question. And as Pamela was speaking, I was wishing that we could speak more, because it really sounds like they had quite a different experience in terms of the response to that network. In our case, I think at the beginning, we were working quite hard to make sure that we positioned Cape Town Together as a sort of organization or a group that would work alongside the government's response and would not counter it. We didn't want to be seen as in opposition, and we were trying to make sure that we worked in support of, partly for, because we wanted things to run smoothly and not to get too politicized, but partly because that there's definitely a belief that that's the way to help most, is to find some coordination. And for a while that did that was possible, and we saw things like we managed to get we had the CANs were producing sort of bottom-up intelligence on, for example, to produce posters on how to keep a community kitchen COVID safe. And then we would be able, by working through existing relationships that members of the network had with people in the Department of Health, we were able to get Department of Health approval on those posters so that we could put them up in community kitchens, and they would have, you know, the right stamps on them and the right sort of insignia that they were formalized and official. And so in the beginning, those kinds of examples were abounding. We and things were much easier. As I think as this kind of national response to COVID began to be more political, just sort of on a social level, there began to be more critique of how the state was responding to COVID in South Africa as a whole. And I think that kind of heightened tensions quite a lot. And then the other aspect of this is that Cape Town is the only province in South Africa that's not run by the same party that runs each of the other provinces, and that is also has, you know, power at the national level. So there began to be these kinds of political tensions in how the Western Cape government was handling the response, and this really heightened the kind of politics of it. And what that meant was that we started to see, for example, Pamela was saying that they could go and say, this is how many people we have, this is how many people we're feeding, can we get, you know, support for this? We were trying to get, the many CANs were trying to get spaces to use either for community kitchens or for community care centers to get public spaces, so community halls or whatever the case may be, but city or provincially owned spaces. And most CANs never managed to get permission to do that. In one case, a CAN that did was then sort of approached by the ward councillor and taken to court eventually on an accusation that they were occupying this land illegally, when in fact what they'd done was renovate a disused community centre and make a community garden on the grounds, and were renovating it so that they could use it for a community care centre. And so in many ways we didn't manage to build a stronger relationship with the state. On the other hand, having said that, we had many, many allies and many members of the government, public officials, civil servants, policemen, teachers, you know, nurses are also members of their CANs. And the language that we developed to talk about this is little g's, as in like we have big government for big G's and little government for little g's. And these are ordinary people who are community members themselves, who are also representatives of the state, but who, you know, are doing their part. And in that way, I think there was a lot of strengthening of the relationships between state and society, because people began to see their little g's as allies, and realized, you know, that despite the kind of challenges of politics and bureaucracy, that there are good individuals within the state. And we developed a number of allies inside the government, and we tried to use Cape Town Together as a way to initiate some change of thinking as a kind of more a long-term strategy. We hope that one of the lessons of this movement will be that the government can in fact engage with informal networks. It just takes a little bit of work and a slightly different approach, but that it is possible.
I like what you talked about initially having participation and then eventually getting into a contentious relationship, so to speak, with government, where there were concerns that maybe you were taking over what should have been their response. I just want to think about this and say, looking at the allies that you have and the support that the little G's have, as opposed to the big G's, what could you say Cape Town Together can do to re-engage government? Because clearly what you are doing works, right? So how can Cape Town Together work with government or re-engage government in a less adversarial relationship?
It's a good question, and it's a hard one. I think we are trying to use the experience of Cape Town Together to to learn those lessons and to learn them kind of publicly. So we've written, and when I say we, I don't mean myself, I mean either the Connecting Cans group or what we call the Writing Cans group, but there's a bunch of other nodes within the network who sort of work on making sure that the story of Cape Town Together is told in a way that's true to the network. And I think one of the kind of goals there is to see what lessons we can draw out about what would have been possible. And for example, at times we faced a pressure to formalize. The line was that we could get support from the state if we were more formalized. So if maybe a CAN would register as an NGO or as a nonprofit organization, then it would be possible to get more support. And we pushed back quite hard on that because of our belief, and I think this is another thing Pamela mentioned, that the informality is so key to how the network grows and spreads and sustains. It's kind of key to its ability to respond to real-time challenges, but also to be based purely on relationships and on trust. And I think that that's what made this network possible, is that we didn't try to institute hierarchies of control or accountability. We trusted each other. We knew that every neighborhood, you know, every CAN knows its own neighborhood best and will have its own particular ideas about what needs to be done there, and that's fine. And so we had to push back against this idea that we should formalize, and that made it more difficult to engage with the state. But then on the other hand, what that means is that you need to just work on relationships. So you can still have a form of accountability that's built on a trusting relationship rather than on a hierarchy of control. And I think that's one of the lessons that we're really trying to sort of publicize and to make front of mind, possibly even for when the next wave comes along, which I think it's becoming clear we're about to enter in South Africa, that we've learned the lesson that it's possible for the state to engage with informality if what they do is build on interpersonal relationships and try to build trust, and that does take time and it takes work, but that it's valuable work, you know.
So just to ask a follow-up question before I move on to Pamela, do you think the city would scale up a Cape Town Together kind of response?
I don't think the city could. I neither think that they would nor they could. I think that what could have happened and what could still happen is that there's ways that the city could endorse what is happening in Cape Town Together and find ways to empower the network, even not through resources, even through things like, for example, encouraging access to community halls or encouraging businesses to work with their local CAN or something like that. That there's lots of ways that the city could have and could still work to strengthen the network. But it is not, Cape Town Together, I don't think could ever fit into any kind of a bureaucracy, because it exists in a very different space and it runs on relationships and on trust. And I think it would be stifled by you know, any attempt to kind of control it or subsume it into the city's plans.
Thank you for that. I know I put you on the spot with that one. but moving on to Pamela, I just want to link my next question to you with what Eleanor has just told us, to consider the political context a little, to think about how that has an impact in the work that you're doing, and also how it has affected how your city is responding to the rising number of soup kitchens. So I know that when you started, it's already been a year, so communities are becoming more aware of what they can do for themselves, and economies have not gone back to what they were. So there is still a big number of people who need to be fed. Taking into account the political context, how has your city responded to this rising number of soup kitchens?
I think the political context here is a major player. We've had, besides the coronavirus crisis, pandemic and economic crisis, social crisis, we've also had a political crisis, because why not? In this last year, we've had Congress shut down. We've had a variety of precedents. I've lost count already. We also have general elections coming up next month. So the political context is really being a key player as well. In reality, these soup kitchens, this community-led soup kitchens, they're not going away anytime soon because the need is still there. And the only thing that is changing is how organized they are and how more interaction there is between them. At the very beginning, when this thing started, probably only a couple organizations, grassroots organizations, mapped 80 or 90 community-led soup kitchens. And to this day, we have over 2,100 community-led soup kitchens mapped just in Lima and just in 30 districts. And there's many, many more there, still not completely mapped. So part of the strategy that the Food Security Working Group has is to not only map as many soup kitchens as they possibly can, but also to share that information, share that data with government and government officials to really say, you know, this is completely organized. We have accurate data of how many people rely on these soup kitchens, and this is what you can do to help. And a couple of the successes there that have really been key, and I think more people should talk about. A lot of this context is not really shown in national media. You only know about this if you're part of a soup kitchen or if you work in some way close to them. But a really big success is that these community-led soup kitchens are now recognized by our government as an essential community-based organization. There was a bill that was passed unanimously by Congress in December. And now, because of that recognition, these soup kitchens are now eligible for a government budget. So our government is saying, yes, we are willing to give you an assigned budget for the rest of 2021. Now we need the data. And of course, the data is already there. So part of that articulation is just happening bits by bits. And there's a lot of politicization behind it as well. A lot of bureaucracy. So it's not happening as fast as it should. But still, these networks and the Food Security Working Group, they're really advocating and working to put this conversation front and center. Another thing that I think is important to talk about is how these community leaders have used social media. And beforehand, really, they were on Facebook to maybe share a couple pictures, but now social media has really become a key to organizing in informality and while in quarantine, while in lockdown. So they've used WhatsApp, Twitter, Facebook, all these social media platforms to share their stories, to share videos and images of the day in, day out of the community-led soup kitchens, from 4 a.m. to cooking to actually handing out food to the community members. And one of the campaigns that became viral was the, what's it called? Pots Against Hunger campaign. So there was a hashtag and it was a trending topic in Peru for almost a full day, which really was amazing and really got a lot of attention from national media, government officials, and more interest from a variety of groups, also private actors that decided we want to help and articulate with different actors, including the municipality of Lima and a lot of different actors across government.
Thank you for that. I mean, I find it interesting how social media is taking a different role in this campaign, and how quite a number of initiatives across the globe are being publicized on social media. So I've seen quite a few, some in South Africa, some in Zimbabwe, some in different parts of the world, basically, just showcasing what they've done. And I think that's an interesting use of social media, and that it trended for a full day means it's a really important initiative. I just want us to move over to Hannah and talk about Baltimore, which has a different relationship to the ones that we've seen from Cape Town and from Lima. That the COVID responses to hunger are not necessarily contesting for space in local government. They already have space, they have room. So this could be, I guess this is where the Lima initiative and Cape Town together are moving towards. But what do you think has been learned from these COVID responses that the Baltimore City will include in future responses. I know you mentioned that they've already responded to a civil crisis. They've already now currently are responding to a disease. What have we seen in this current response that they could potentially scale up in the future?
That's a really interesting question. One of the biggest changes, I think, in response on both the city level, municipal level, and within individual food actors is a real emphasis on the sustainability of the food system. So we're not just talking about a incidental emergency and responding to that. There's an immediate need, of course, but how can those immediate responses play into mitigation, basically, of future events? And so I'd actually like to answer it from the perspective of what we're seeing from the community-led food response, and then how the government and the city can respond. In the case of one organization we looked at more deeply, they're called Mirror Kitchen Collective. Their initial response was an immediate pivot to just providing food to their community. So once catering and their pop-up events were canceled, they continued on, just kept all of their staff, and all cooking, all activity was directed towards community feeding and connecting with organizations that would be able to get food into the hands of those who may need it and who may not qualify for other programs. And it's really interesting because they highlight specifically how much their meals cost. So they, as opposed to, so their budget per meal was $10. And this was a really holistic number, was not only accounting for the labor of their employees to maintain a living wage for them, to be able to provide security for those who are doing the work, to provide food. But they're also, this was a budget that included procurement of local food. And this is informing, I think, the budget and response of cities. So their average budget for meal allocation under a supplemental nutrition assistance program, which is a federal level program that is providing a variety of different meals, whether it's food distribution boxes or actually money for food for folks and individuals in need. That budget is under $3 per meal. And so it's really interesting that these businesses were able to bring that mentality of sustainability, of how do we keep a business running. And that includes an awareness of the labor, the sourcing, the distribution. We're still going to keep it budget friendly. So their aim is $10, but that can influence budgets for the city, what they're allocating. And in turn, the value that they're emphasizing in that budget is contributing to longer term mitigation. So they're really concerned about building connections across the food system network to create a stronger network that is able to withstand and able to pivot in that way. So I think that's one huge change that we've seen in the language, especially of how the municipal actors are talking about emergency food response. They are really taking that long view and thinking about how they can sustain and mitigate for future events.
Thank you very much, Hannah. That's an interesting take, that their response not only catered to hungry people, but also was designed to keep businesses alive, small businesses alive. So that's really interesting. Now I know that our take on these responses has been the positive that they can do, but I want to flip it a bit, because I know not everyone has good intentions, right? We have good initiatives that build on strong existing community networks, but that also, to quote what Eleanor said, that emerge where they're needed and do what needs to be done. So thinking about that and thinking how people could potentially take that and flip it into a negative, I just want to ask, and maybe for this one, I will say whoever wants to go first has the mic. In what way do you think the projects that you've described could be used, for instance, to introduce negative values, or could be taken over by other actors with a completely different agenda? If you've seen something like this in your community or in communities nearby. So whoever wants to go first can unmute themselves and respond.
I can start. Kind of the experience here with community-led soup kitchens, it is based on trust, as Eleanor said, and relying on accurate information, I guess. And some community members from informal settlements have made up their community-led soup kitchens and said, oh, we have this soup kitchen, we feed 50 people, this is what we need. But in reality, they didn't have a soup kitchen and they didn't have a formal structure. It was just an invention, I guess, to get some donations from local governments. So that has made it more difficult for formal and sometimes for real community-led soup kitchens to get things that they need. But that's also why there is this network of 2,100 soup kitchens that are officially registered, geo-localized on a map as well. And it's all a work of volunteers, a variety of 60 plus of organizations that work together. So I think that's really important. Not just the community members themselves and informal settlements, but also articulating with a variety of actors to say and to show, yes, we exist, we are there, we actually do feed all these people. So that on one hand, and then on the other hand, as I mentioned before, we do have elections next month, and unfortunately, these ollas comunes, these community-led soup kitchens, have been completely politicized. They're front and center in political campaigns. Pretty much all these community-led soup kitchens are an official stop for all the candidates. So they're using clientelism to all its extent and promising food and infrastructure and formalizing and all these false promises that in reality, they're not going to happen because these community-led soup kitchens are not meant to be formalized. They are an ad hoc response, and whenever the crisis is over, they will disappear. That is the point of these, the structure, basically. So it is really sad in the national context, in the national narrative. There is a positive dialogue, but when it comes to politics and politicians running for office right now, the majority of speech and rhetoric is negative and using them as a campaign speech, pretty much.
I like that you've shown us that the abuse of these soup kitchens is across the board, from falsifying or creating soup kitchens where none exist, but also to politicians using them as a campaign strategy. I don't know if Hannah and Eleanor want to add something, but also just to remind our participants that they can join us by asking questions, and we'll answer them.
Can I jump in, Vongai? I think a lot of what Pamela said really resonated. The issue of the potential for politicization is very real. I wanted to note one of the things that we struggled with a lot was the way that the network and the community kitchens in particular became perceived was as this sort of purely feel-good story. And to me, that felt like a real risk, and it's something that some of us within the network started to push against, because what it does is it becomes something that obscures the work, the labor, and the kind of, that these are what the cans are, is people in most of the neighborhoods in which they exist. It's people with very few resources managing to scrape something together, to come up with something and to share it around. And that is a feel-good story in some ways, but on the other, if you tell it only as a feel-good story, you obscure the fact that it is a failing of the state, that this needs to be done at all, and that the fact that the community kitchens had to feed 300 people a day for 9 months it shouldn't be seen just as the sort of magical thing that happened because people worked together and trusted one another, even though it should be seen as yet another example of the work of mostly women coming in and picking up the pieces because nobody else is doing it, and it has to be done, but yet it's not it's not their job, and that labor is often unrecognized and often obscured. And as Pamela was saying, it's not just cooking for 300 people, and making sure you can do it every day requires an extraordinary amount of budgeting and organization and foreplanning and sort of mobilization of the people around you, that the labor of that really has to be recognized. And then I just wanted to pivot from that to this, that I think one of the challenges that we faced was that it can happen that in a sort of community-led network like this, the sharing of resources, especially in a city as kind of economically divided as Cape Town, becomes about charity that is about hierarchy and not about getting to know each other and working together to solve a problem, that you can sort of do your part just by giving money. And we really tried to push against that, because what it creates is a sort of distinction between the benefactor and the beneficiary. And what Cape Town Together is, or should be, is people working together because they're facing similar problems, and that any giving, any sharing of resources is also on the back of a sustained relationship, in which there is communication about what the challenge is, and in which the sort of knowledge and experience of the can, even if that can is receiving resources from another can, that what is recognized above all is their experience, their knowledge of their own community and the work that they're doing, and that we don't fall into the trap of highlighting the beneficiary, the benefactor, And I think sometimes this kind of mode of charity that is really unhelpful starts to emerge, and then it becomes something that is disempowering or just unhelpful, and isn't about recognizing that COVID is actually affecting everybody, and that it's a challenge that we all have to actively work on together.
Thank you for that, Eleanor. I don't know if Hannah has something to say on this, or we can move on to something else.
I do. Both of your perspectives are really, really interesting, and I would echo that. Similar concerns whenever the relationship is at the core and trust is at the core. There's always a risk of actors, organizations, or individuals not really seeing that for the gold it is, and for the capital it is, the social capital, as Pamela has mentioned, and taking advantage of that. But I believe the language that is being used by the organizations in Baltimore, particularly, they're very straightforward about how this is not an individual issue or an individual crisis. This is a long-term view, and so this relationship building is a continuous, ongoing process, whether or not we're in a pandemic setting. And so really building capacity around that approach, I think, is hopefully can curb the potential negative.
Thank you for that. So I can see that we don't have any questions from the audience. So I'll just throw in one that came up as a result of what Eleanor was saying about building relationships, but also that there's a lot of potential for other activities to take place based off what the women are doing to make the soup kitchens run efficiently. I just wanted to ask all three of you, have you seen other services or other opportunities open that are related to the soup kitchen, or that have come up as a result of the soup kitchen, and based off of the relationships that you mentioned are being built in the communities. And again, anybody can unmute themselves and respond.
I can jump in just to get this conversation going a bit. Is as you know, in the initial moments of the lockdown and COVID, and when everyone was very scared and frightened, I think there was a lot of resource flow. And as the pandemic wore on, and especially as people started to go back to work, it became harder and harder for CANs to raise enough money to supply the community kitchens. And one of the things that started to crop up, and in fact was one of the nodes in the network, so one of the kind of connecting nodes, is the food growers node. And a lot of the CANs have started their own community gardens to run alongside their community kitchens. And through the food growers node, they are sharing seedlings, but also information. One of the challenges that we have is that because of Cape Town's apartheid geography, again, a lot of the less well-resourced neighborhoods are in areas with very poor soil quality. And so there's a lot of challenge for growing in that environment. And so sharing, good soil, but also seeds, and also just tips and tricks, and working together to, you can put out a call on the group and you'll get some volunteers to come to your neighborhood and help you, get your community garden started. And that's been really amazing to see, because it's a way of kind of sustaining some of these kitchens.
That's really great. Anything from Lima or Baltimore?
Yeah, I can just mention a couple things from Lima. These, again, community-led soup kitchens, and more importantly, the food security working group now has a seat at the table. Now these community leaders are participating in crucial meetings with a variety of ministries. So specifically, the Ministry of Inclusion and Social Development, Ministry of Women and Vulnerable Populations, when before they didn't have a seat at the table and they were not really consulted for these strategies. Because of the food security working group and the conversation that really goes on there, with this amazing trust and solidarity between all these different actors. Again, 60 plus organizations, from faith-based groups, NGOs, international cooperation, and just neighbors and people that are interested in helping out. They all participate and articulate to really have a single voice and to demand things that everyone talks about, and then there's a vote, and that's how you move forward. So it's really a coalition of things that work together. And similar to what Eleanor said, there are urban agriculture gardens, COVID committees as well, in some of the community-led soup kitchens, nutrition trainings as well. So a lot of different things have emerged, and really there's so much potential because they're incredibly organized, that different organizations want to give out trainings and want to give them even specific donations, because they know who it's going for, and that there is a amazing transparency there. So that's also really important to talk about.
I'm just seeing that we have a question from the audience, and they are asking us, what do you see as the lasting impact of your work? In many ways, the pandemic has highlighted inequalities that already existed and will not go away once the health crisis is under control. Eleanor mentioned that there's a risk in formalizing the CANs, and Pamela mentioned that the soup kitchens are not meant to be permanent. If these initiatives will not go on forever, how do you see them winding down, and what do you hope will be the next phase? This is a really good question. Who wants to go first?
I'll go first. That's such an amazing question. Thank you, whoever asked that. I think that we can highlight the social network and the relationships that have been built throughout this whole year and a little bit more of crisis response. Even though the structure of the community-led soup kitchens in Lima will probably not be permanent, because that's not the purpose of the community-led soup kitchens. but the networks and the bonds and the relationships, the connections that are there, and also the visibility of these community leaders will not go away. I don't think I've shared as well as I should how these community leaders are now nationally recognized. So people know who Fortunata is. She is the president of the network of community-led soup kitchens, and she is a thought leader as well. And she shares her experience all the time. She doesn't have a Twitter account or anything like that, but if she did, she would have all the followers in the world. But yes, these social networks and relationships are here to stay. And I think that's something really, really critical that these community-led soup kitchens can leave behind.
Thank you for that, Pamela. Anybody else?
I can jump in. Pamela, I feel like I would have said the exact same words if I'd gone first, just about the relationships. And I think a lot of CAN members, at the end of last year, we did a kind of review process and produced we called it not quite a cookbook, but one of the lessons of that was really that the what is going to sustain, even if, although many of the community kitchens and the other, COVID response initiatives in the CANs are still running, but people definitely feel like what will sustain to the next crisis, whatever it may be, is the relationships that have been formed, and relationships that might not have been formed otherwise because of the divided nature of Cape Town. And just that already we're seeing that these groups are managing to respond to other crises. So for example, in some of the informal settlements in Cape Town, there's a huge risk of fires. And when a fire breaks out, many people lose their homes and what possessions they had. And we are seeing the CANs being able to be the kind of organizing hub to respond to those kinds of crises as well. So that I think will sustain, because now that the relationships have been formed, there's never any shortage, even in a non-pandemic year, of events that destabilize communities and that people need to respond to.
Thank you very much, Eleanor. Hannah, do you have a response, or should I ask my next question?
I would love to say and highlight the not only relationships, but what we saw in Baltimore from folks who were not before engaged in any kind of emergency food response or any kind of emergency response pivoting, was also the power of collaborations. That's kind of a form of relationship building, of course, but we really saw like organizations and businesses and other entities saying, okay, we have folks who are, we have food over here, we have a kitchen over here, we have folks who are distributing over here, and forming not only collaborations in the moment, but in the case of several businesses that we were following and observing through the initial months of the pandemic response, have now, a year and some later, formalized those collaborations. So for Mirror Kitchen Collective and their initial partner, Alma Cocina Latina, they are formally now have a joint organization that is focused on sustaining not necessarily food distribution, but the longer view of that. So what does healthy, sustainable food and meals look like that's cost effective, that also still pays labor? So they have integrated what they learned from the community food, from COVID food response, and how that reflects the kind of brokenness of the food system we're operating in, and have now formalized an approach to doing business differently and to serving their community differently in the long term.
Wow, I mean, that's really, really exciting. So guys, we've come to the last question. And for this, I will ask you guys to be very brief. So I'll give you about a minute each. And I will say, if you're speaking to potential community organizers, or you're speaking to city officials in your city, what would you say are the lessons you've learned on how to do this well? And what support do you need from the city? 1 minute, starting with Eleanor.
I would say that, you make a mistake if you think that just because Cape Town Together has a flat structure, we have no structure at all. The idea that we can't engage effectively with the government because we don't have a structure it's incorrect, because we have a structure, we just have a flat structure, and that makes us maybe almost easier to engage with, because you can just come in at any point in the network and people will embrace you and tell you where to go and tell you who to speak to, and that shouldn't be something to be afraid of. It's something to be embraced, and there's a power in our informality. And I think that would be my lesson that I've learned, certainly for myself as being a part of this network, is just that there is a power and a value in informality and in relationships and in network building, and that it takes a lot of work, but that you get so much further when you put in the work to build the relationships with other individuals. And then lastly, just to say that this kind of what we've shown is that what Cape Town Together has shown is that radical generosity is possible, and that a new kind of society is possible on the basis of this radical generosity, and that you can give without expecting anything in return, without implementing some kind of hierarchy of accountability. You can just give generously, and magic will start to happen on the basis of that. And it's such an important lesson.
Thank you for that. So it's about flat structures are easy to embrace, and generosity, radical generosity, is still possible. Pamela, you.
Yeah, I think I just want to highlight what I said before. These women in informal settlements, especially the ones that are leading community-led soup kitchens, they have amazing skills, untapped potential that needs to be recognized. Again, they can budget, they can organize, they wake up 4 a.m., 5 a.m. in the morning to get things done. They're able to articulate and advocate with a variety of actors, no matter who they are. And on top of that, they're able to take care of their families and their communities and cook a meal for all these communities as well. So I think in reality, they're kind of Wonder Woman in some sense. They can do everything and more. So that potential really needs to be recognized. And another thing, communities and including community leaders in the co-production of policy is crucial. A big mistake that our government made at the very beginning of lockdown was not taking community leaders and the informality that Peru has into context. They pretty much put in place the same strategies that were put in place in Europe or in the US and Canada. That does not work here. So that's very important. Context must be taken into consideration, specifically in places where informality prevails.
Thank you for that. So context matters, and recognize the women who lead this. Hannah, over to you, and you have just a minute.
Well, there's not much more I would add in response to what the city has really been working hard to build in terms of a food response and in terms of a long-term food vision for the city of Baltimore. So I would really encourage them to continue taking a network level view and continue inventorying what assets are available in each community. They do a really good job of not only highlighting need, but highlighting the assets. And so taking a network view to facilitate more collaborations across the city, and connecting organizations, connecting resources, and being a conduit for strengthening the city, community by community, into a beautiful quilt, and instead of a net with holes in it.
So thank you for that. So you end with the importance of a network approach, not necessarily an individual approach. So I'd just like to thank you, my panelists, and to thank the audience who's been with us for the past hour and 15 minutes. I know we went a bit longer than we had intended, but just to say thank you very much. So this is the end of our panel. I'd invite you to log off, take a cup of coffee, and then see what other panels are on. I know there's still a few things going on after this, and also to watch the closing remarks. Thank you very much, and bye-bye.